In this video, we'll discuss about disorders of purine metabolism. Most common disorders of purine metabolism is hyperuremia or increased uric acid level in blood. So, most common disorder of purine metabolism, hyperuremia or increased uric acid level in blood. Normal uric acid level 3 to 7 milligram per deciliter in male, 2 to 5 milligram deciliter in female. This one is the normal uric acid level in male and female. In hyperuricemia, in male more than 7 mg per deciliter. In the case of female more than 6 mg per deciliter, it's said to be hyperuremia. Most common cause of hyperuremia is gout. This gout is characterized by increased uric acid level. Then uric acid deposits crystal of uric acid is known as monosodium urate monohydrate crystals. Crystal of uric acid is called monosodium urate monohydrate crystal, MSUM. Deposits in synovium joints, under the skin, cartilage, soft tissue like kidney tubules. It may lead to kidney stone. Gout is characterized by increased uric acid level. Uric acid deposit in crystal form is known as monosodium urate monohydrate crystal. This one will deposited in synovium joints, under the skin, cartilage, soft tissue like kidney tubules. It may lead to kidney stone. With most common constituent inflammation of the joint leading to arthritis, it is known as gouty arthritis. Most consequent inflammation of joints is called gouty arthritis. This may be also nodular masses of monosodium urate monohydrate crystals in the distal joint of that foot, which are known as tophi. These are the characteristic of gout. So most consequent inflammation in joint is called gouty arthritis. Then nodules mass of crystals in a distal joint of that foot is known as tophi. These are the characteristic of gout. Next, types of gout can be measure of two types, primary gout and secondary gout. First, we will discuss primary gout. Primary gout because of overproduction of uric acid, and 10% of primary gout is idiopathic. That means that reason is unknown. It may familiar incidence. So, causes of primary gout. First reason, causes abnormal glutamine. Then PRPP aminotransferase enzyme, phosphoribosylpyrophosphate aminotransferase enzyme. So its abnormality not sensitive to feedback regulation in the end product, which leads to overproduction of purine nucleotide and uric acid. So first causes reason abnormal glutamine and PRPP aminotransferase enzyme. Abnormal enzyme PRPP synthetase overproduction of purine nucleotide and uric acid. Third reason, deficiency of enzyme of salvage pathway. Salvage pathway. When there is deficiency of salvage pathway, the PRPP will accumulate and there is decreased purine. So there is decreased feedback inhibition. Due to the de novo synthesis pathway, there is overproduction of purine nucleotide. So there is more uric acid. Next reason, glucose 6 phosphatase deficiency. Glucose 6 phosphate deficiency occurs in von Gierke disease. It is also known as glycogen storage disease type 1. Here, if glucose 6 phosphate, absence of glucose 6 phosphatase enzyme is not converted into glucose. This glucose 6 phosphatase enzyme absent means this glucose 6 phosphate is not converted into glucose. If this enzyme absent is not converted into glucose, so glucose 6 phosphate enter HMP shunt or HMP pathway. So there is increase ribose 5 phosphate. So there is increase ribo 5 phosphate. So there is increase PRPP. So there is increase purine nucleotide, then increase uric acid. First reason, abnormal glutamine and PRPP aminotransferase. Second one is that deficiency of enzyme in salvage pathway. Third one is glucose 6 phosphatase. Then fourth one is abnormal glutathione reductase enzyme. It is NADPH dependent one. There are two product of HMP stent. First one is NADPH and another one is ribose 5 phosphate. If abnormal glutathione reductase enzyme NADPH production is less, NADH production enzyme is less from pentose phosphate pathway, PPP pathway, and ribose 5 phosphate production is more. There is more ribose 5 phosphate, more PRPP. More PRPP means more purine nucleotide. More purine nucleotide means more uric acid. So these are the causes of primary gout. What are the things? Abnormal glutathione and PRPP aminotransferase enzyme, then deficiency of salvage pathway, then this glucose 6 phosphatase enzyme absent means high amount of uric acid production, then abnormal glutathione reductase enzyme. Next, secondary causes of gout. Secondary means secondary to some other causes. Secondary to some other causes is it may be due to overproduction of uric acid. What are the causes? There are increased turnover rate of nucleic acid, increased turnover rate of nucleic acid, like rapidly growing malignant tissue, or malignant tumor, that leukemia and lymphoma. Then increase tissue breakdown, increase tissue damage or breakdown after treatment of trophoblastic tumor. So second reason here, increased tissue breakdown after treatment of trophoblastic tumor. Third reason, increased tissue damage or breakdown due to trauma, and increased rate of catabolism in starvation. So first reason, increased turnover rate of nucleic acid, that means rapid growing malignant tissue, leukemia and lymphoma. Then increased tissue breakdown. Third one is increased tissue damage because of increased rate of catabolism in starvation. Next, due to reduced excretion of uric acid. This may be due to renal failure. Kidney cannot excrete uric acid. Treatment with thiazide. Treatment with thiazide diuretic. Thiazide diuretic with inhibit tubular secretion of uric acid. Then lactic acidosis and ketoacidosis due to tubular secretion. These are the secondary causes of gout. What are the secondary causes? First one is increased turnover rate of nucleic acid. Second one is increased tissue breakdown for that cancer treatment. Then increased rate of catabolism of starvation. Then reduced excretion of uric acid, lactic acidosis, ketoacidosis, treatment with thiazide diuretic. These are the causes, secondary causes of gout. Next, clinical finding. Gouty arthritis first affect metatarso-phalangeal joint. Metatarso-phalangeal joints of big toe, and other joints also may be affected. Primarily affected metatarso-phalangeal joints and other joints also. There is early morning pain precipitated by high purine intake or high intake of alcohol. Kidney stone also. Treatment: decreased purine intake, purine containing diet, and decreased alcohol. Second one is drugs. Uricosuric drugs. Those drugs which increases the excretion of uric acid from kidney tubules or decreased reabsorption of uric acid from kidney tubules. So uricosuric drugs, uricosuric drugs. Here what is the role? Increase excretion of uric acid or decreased reabsorption of uric acid from kidney tubules. Then some drugs like profercit, then allopurinol. Allopurinol is hypoxanthine analogous. Allopurinol acted upon by xanthine oxidase. This allopurinol acted by xanthine oxidase. Allopurinol to form alloxanthine or oxypurinol. Now this alloxanthine is effective inhibitor of that xanthine oxidase. So this is an example of suicide inhibitors. Then that xanthine oxidase inhibited uric acid is not formed. So this is the mechanism of action. Allopurinol is the hypoxanthine analogous. it acted by xanthine oxidase. This allopurinol to form alloxanthine. This alloxanthine acted by xanthine oxidase. So alloxanthine is an effective inhibitor of xanthine oxidase. This is the mechanism of action. This xanthine oxidase inhibited, so uric acid is or not formed. Then colchicine. This drugs is anti-inflammatory drugs. So this is all about gout. Next disorder is Lesch syndrome. Lesch syndrome, it is an X-linked inherited disorder. Here there is deficiency of enzyme hypoxanthine guanine phosphoryl transferase. Deficiency of hypoxanthine guanine phosphoryl transferase enzyme. When the deficiency of this enzyme, there is degrees of salvage pathway. So there is accumulation of PRPP as well as accumulation of PRPP as well as decreased inhibitory purine nucleotide. So where is decreased inhibition of purine nucleotide? Increased production of purine by de novo synthesis. So there is increased uric acid level, there is hyperuricemia. So here what are the condition? It is an X-linked disorder because of deficiency of hypoxanthine guanine phosphoryl transferase enzyme. Deficiency of this enzyme decrease salvage pathway. After that, accumulation of PRPP, so it will decrease inhibitory purine nucleotide. So increase production of purine by de novo synthesis. So increase amount of uric acid, it causing hyperuricemia. Next, clinical finding, self-mutilations. There is mental retardation, there is kidney stone, gout also developed in later life. This is all about Lesch syndrome. Last one is severe combined immunodeficiency, SCID. It is an autosomal recessive disorder and it is due to deficiency of enzyme adenosine deaminase. Function of this adenosine deaminase enzyme is adenosine is converted into inosine. When there is deficiency, is not converted into inosine. That's why increasing adenosine and increasing DATP up to 50 to 100 times. And this inhibit enzyme ribonucleotide reductase. This one will inhibit enzyme ribonucleotide reductase, which is responsible for production of deoxyribonucleotide. Then there is decreased deoxyribonucleotide synthesis, there is decreased DNA synthesis. So there is decreased D and B lymphocytes. Decreased deoxyribonucleotide synthesis means decreased DNA synthesis. So decreased DNA synthesis decrease B and D lymphocytes. So leading to deficiency of cell-mediated and humoral immunity. It is combined one. This D cell mediated, B cell humoral. So it is a combined one. So it have that name, severe combined immunodeficiency. What are the treatment? Treatment is complete isolation from the environment to protect from infection. That is why it is known as Fubel boy disease. And gene therapy also been successful in severe combined immunodeficiency. Gout arthritis, 5 types, causes, secondary gout causes, clinical finding. Thanks for watching.